Hello everyone, my name is Lauren Boutz, and today I'll be presenting my review of social support as a well-being construct for promoting positive mental health among Diné adolescents and young adults living within the Navajo Nation. Mental health promotion is a strengths-based approach within public health that focuses not only on preventing mental illness, but also on strengthening the protective factors that help individuals and communities thrive. Rather than focusing only on reducing symptoms or disease, this perspective emphasizes resilience, well-being, and the social and community resources that support positive mental health. Throughout this presentation, I'll discuss why social support is an important protective factor, how researchers measure it, what intervention studies suggest about its role in promoting positive mental health, and finally, what these findings mean for future public health research and practice. Before discussing the intervention studies, I want to briefly define what I mean by social support, because it's the central well-being construct throughout this review. Broadly, social support refers to the perception or experience that an individual is cared for, valued, and has access to assistance through supportive relationships. House described four primary domains of social support: emotional, instrumental, informational, and appraisal support. Together, these domains illustrate that supportive relationships can promote health through multiple pathways. Across the broader literature, greater perceived social support has consistently been associated with improved coping, resilience, help-seeking behaviors, and lower levels of psychological distress. Within many American Indian and Alaska Native communities, supportive relationships often extend beyond individual interactions to include family members, elders, cultural teachings, community belonging, and collective responsibility. Importantly, these strengths should not be viewed as universal across all tribal nations. Rather, they reflect culturally specific social and community contexts that vary among indigenous communities and reinforce the importance of culturally grounded public health approaches. Because social support cannot be observed directly, researchers rely on validated instruments to measure it. Across the intervention studies I reviewed, two measures were used most often: the multidimensional scale of perceived social support, or the MSPSS, and the social provisions scale. Both instruments demonstrate strong reliability and construct validity, but they measure supportive relationships in somewhat different ways. The MSPSS focuses on perceived support from family, friends, and a significant other, while the social provision scale evaluates several functional dimensions of supportive relationships, including attachment, guidance, reassurance of worth, and social integration. Overall, both instruments provide valid approaches for measuring perceived social support. However, based on the intervention literature I reviewed, the MSPSS appears particularly well suited for adolescent mental health promotion research because of its excellent psychometric performance, brief administration time, and its close alignment with the intervention studies included in this review. Let's begin with Kunasvik, a community-developed, culturally grounded intervention created in partnership with Yupik communities in Southwest Alaska. Unlike many mental health programs that are adapted after development, Kunasvik was designed through a community-based participatory research partnership. Youth, elders, families, and community leaders all contributed to the development of intervention activities that reflected local culture, knowledge, and priorities. Throughout the program, supportive relationships were strengthened through cultural participation, mentorship, intergenerational learning, family engagement, and community responsibility. The evaluation demonstrated improvements in protective factors associated with positive mental health, including resilience, community connectedness, and reasons for life. Although the intervention was developed specifically for Yupik communities and should not be assumed to transfer directly to other tribal nations, it provides strong evidence that culturally grounded, community developed interventions can strengthen supportive relationships and promote positive mental health. The next intervention is BRAVE, which was developed specifically to promote positive mental health among American Indian and Alaska Native adolescents through culturally tailored mental health promotion. One of BRAVE's greatest strengths is that it was intentionally designed for AIAN youth rather than adapted from an intervention created for the general population. Throughout the program, participants strengthened supportive relationships with family members, peers, trusted adults, and their communities, while also developing communication and help-seeking skills. The evaluation demonstrated improvements in resilience, coping, self-efficacy, and overall mental well-being, suggesting that strengthening supportive relationships contributes to positive mental health by increasing protective factors. Although relatively few culturally tailored intervention studies have been conducted specifically with AIAN adolescents and young adults, BRAVE provides encouraging evidence that interventions developed in partnership with Indigenous communities can strengthen supportive relationships and improve positive mental health. The next intervention, Sources of Strength, takes a somewhat different approach by using a peer-led, school-based model to strengthen supportive relationships. Rather than focusing primarily on identifying students at risk, the program encourages adolescents to build supportive peer relationships, strengthen trusted adult connections, and identify multiple sources of support during times of stress. The randomized controlled trial demonstrated improvements in supportive peer norms, trusted adult relationships, help-seeking behaviors, and reductions in suicide attempts. A major strength of this study is its rigorous design, which provides encouraging evidence that intentionally strengthening supportive relationships can promote positive mental health. However, because the intervention was originally developed within general school populations, future implementation within AIAN communities should continue to be guided through collaboration with tribal communities to ensure cultural relevance and responsiveness. The Connection Project focuses specifically on strengthening peer relationships within school settings. Unlike several of the previous interventions, social support is not simply one component of the program. Instead, strengthening supportive peer relationships is the primary mechanism through which positive mental health is hypothesized to improve. Participants engaged in structured opportunities to develop authentic peer relationships, increase mutual support, and strengthen their sense of belonging within the school community. The study demonstrated improvements in perceived peer support, relationship quality, and depressive symptoms, providing strong evidence that intentionally strengthening supportive relationships can promote positive mental health. However, because the intervention was developed primarily within non-Indigenous school settings, future adaptations should continue to recognize the broader forms of social support that are often especially important within many AIAN communities, including family relationships, elders, cultural mentors, and community leadership. The final paper differs somewhat from previous intervention studies because it does not evaluate a single intervention. Instead, Wexler and colleagues examine community-centered approaches to promoting positive mental health by emphasizing relationships, cultural continuity, youth leadership, and community engagement as foundational protective factors. One of the most important contributions of this paper is the recognition that supportive relationships are not simply individual characteristics. Rather, they develop within broader family, cultural, and community systems that shape opportunities for connection and belonging. The authors also emphasized that effective mental health promotion depends on meaningful community partnerships throughout intervention development and implementation, rather than on positioning Indigenous communities as recipients of externally developed programs. Taken together, this perspective broadens our understanding of social support. It reinforces the importance of strengthening relationships, cultural continuity, and community partnerships while recognizing the diversity and sovereignty of individual tribal nations. As I reviewed these 5 studies, one pattern became very clear. Although the interventions differed in their settings, target populations, implementation strategies, and outcome measures, each intentionally strengthens supportive relationships through peers, families, trusted adults, communities, or culturally grounded social networks. Together, these findings suggest that supportive relationships are an important protective resource that can promote positive mental health across diverse adolescent populations. Another important finding was that community partnership matters. Culturally developed interventions such as BRAVE and Kunazvik demonstrated how cultural grounding and collaboration with indigenous communities can strengthen the relevance and sustainability of mental health promotion. Wexler and colleagues extended this idea by emphasizing that sustainable mental health promotion depends on strengthening community conditions that support relationships, cultural continuity, and youth leadership rather than relying exclusively on interventions directed toward individuals. Several limitations should also be acknowledged. Social support was conceptualized and measured differently across studies. Interventions evaluated multiple indicators of positive mental health, and relatively few intervention studies have been conducted specifically with AI and adolescents and young adults. Overall, the evidence suggests that strengthening supportive relationships represents a flexible and meaningful strategy for promoting positive mental health while reinforcing the importance of community partnership, cultural grounding, and respect for tribal sovereignty. These findings have several important implications for public health practice. First, mental health promotion initiatives should intentionally strengthen supportive relationships rather than focusing exclusively on individual behavior change. Families, peers, trusted adults, elders, and communities all represent important protective resources that support positive mental health. Second, the evidence suggests that community partnership and cultural grounding should be integrated throughout intervention development rather than added after an intervention has already been designed. Community-developed approaches are more likely to reflect local priorities, cultural knowledge, and existing community strengths. Third, supportive relationships develop within broader systems, including families, schools, communities, and cultural traditions. Promoting positive mental health, therefore, also requires attention to community conditions that create opportunities for connection, belonging, and culturally responsive support. Overall, these findings reinforce that effective mental health promotion extends beyond individual interventions by strengthening the relationships and community systems that support well-being. In conclusion, the evidence reviewed in this paper supports social support as a meaningful and measurable well-being construct for promoting positive mental health among Diné, adolescents, and young adults living within the Navajo Nation. Across diverse intervention approaches, intentionally strengthening supportive relationships with family members, peers, trusted adults, elders, and communities was consistently associated with improvements in positive mental health and related protective factors. Future research should continue to prioritize collaborative partnerships with tribal communities, the development of culturally grounded interventions, and the use of validated measures of social support while recognizing the diversity, strengths, and sovereignty of individual tribal nations. Ultimately, the findings reviewed in this paper suggest that the greatest opportunities for promoting positive mental health may emerge not simply from individual interventions, but from strengthening the relationships, communities, and partnerships that enable young people to thrive. For public health practitioners, these findings reinforce the importance of developing mental health promotion initiatives in collaboration with tribal communities while building on existing community strengths and protective relationships. Thank you for listening.